Dr. Tobler, how are you?
Good. Thanks for having me.
Thank you for coming, man. You and I are getting connected because IVF, which is something that I've known about for a long time, a dear friend of mine who actually was the officiant at my wedding, he and his wife used IVFs to have their two beautiful daughters. And they used it a long time ago. Like it was the kind of thing of like in 2000, 2001, and they had both had careers and they were a little bit older in their late 30s, early 40s. And they got married late and they wanted to have families. And this was something that was really important to them. I had a student also whose mom whose family had used IVF to conceive him. And she was, again, a professional woman. And she was like, listen, man, it was like, she made a joke. She's like, I call these my $1 million kids. She was a stockbroker. So she was like, we spent and I think he was born in like the late 80s. Mm-hmm. And she's like, we spent an ungodly amount of money on IVF. And it has become more affordable than it once was and more accessible to more average people instead of only the highest of well-heeled parents. Mm-hmm. But it's also come under fire from politics. So it's like we have this budding technology that's making it more accessible, but then at the same time, people are getting more and more worked up about it because of the nature of the process. Talk to me about it. How'd you get into this?
So you arrive at being an IVF doctor through a pathway training. So med school, then you do an OB/GYN residency. It's about 4 years. Then after that, 3 years of training in the specialty of reproductive endocrinology.
Got it.
So that specializes you mainly to do IVF, but also essentially any endocrine problem related to the reproductive system. That could be surgical and then IVF.
If you're listening to this podcast on Apple Podcasts, Spotify, or any other audio-only platform, please jump down and give it a quick follow and a review. The Ranch Podcast is the only podcast in the state of Idaho that has access to this many Idaho leaders, and your support is greatly appreciated.
Got it. So IVF has been around for some time, but in recent years, technology and procedures have been getting better to make it more accessible, correct?
Correct. Oh, yeah. Every year we get better.
What's the nature of that? Are you guys just getting better at like that?
Well, when you think about it, so the first IVF baby was born in 1978 in the UK. There's actually a really good documentary on Netflix. And right now it escapes me the
just Google 1978 IVF
and it actually
baby.
really takes you through. Okay, so when they got that set up, and then it took another few years to get the second one, which was in Australia. Then the third one was in the United States. That's your third baby. Now you're pushing into the 80s. So if you look at the cohort of kids coming through, so like the technology, it was still experimental. Then by the end of the 80s, you had like maybe 10 clinics, all associated with like big name academic institutes and associated with research, trying to figure it out. I mean, these guys, we use the term staying on the shoulders of giants, right? These guys were just figuring it out. It's like, I watch this, I'm like, how did they even think of what I'm doing to make it work? So then you think about that. And then in the 90s, when it really came to kind of fruition, where it's like, okay, this actually can work and we can apply it clinically to actually help people in a feasible way. Not just like, can it be done, but actually can it help, for the resources used, help enough people.
Gotcha. And again, the nature of IVF is essentially you create a hyperfertile state for the woman who then produces several viable eggs. You harvest those eggs and mix them with obviously the sperm from whoever the other person is, right? Husband or donor or whatever it might be. You have hopefully a fertilization with, multiple eggs, which you can check. And then you store those and then you have a reinsertion of those eggs into the either the mother or surrogate or whoever is going to be growing the baby in her uterus. And you reinsert those. And generally you insert multiple because they don't all take, right? They still have to hit appropriately in the lining of the uterus. They have to be fertilized properly. They have to, all these things. And in that process, you're like, look, say we have 10 fertilized eggs and then we go ahead and insert, 3 or 4 of them and then one takes. You're like, yes, we got it. One took. Awesome. But we had to insert 4 and only 1 took. And then the other 6, we either storing those or they get destroyed in the process.
Mm-hmm. Yeah. So yeah, you kind of outline it pretty nicely. So there's several parts right now how IVF is done. So you kind of brought up, Scott, where do you even start? Okay. So let's just start with like the basic science of it all. So the first episode, so IVF, so what you do is IVF is just an umbrella of different technologies where you have sperm and egg outside the body. Depending on the diagnosis, why they need to do this, then you apply certain technologies through that process. But the ultimate kind of issue is it's difficult to get eggs outside of the body. The other challenge is the technology is not perfect. Also, the biology is not perfect. Human beings are notoriously not good at reproducing as compared to like our mammalian cousins, mice or dogs.
Gotcha.
Like you put two perfectly paired people together, they try to have a baby about 25% per month. That's your baseline. So then now you start kind of applying now there's a problem. Depends what the problem is. Now you have a problem that you're trying to overcome, but you need the eggs. So when you describe the woman takes some medicine, so she takes medicines for about 2 weeks. What these medicines do, they make a group or a cohort of eggs grow. And it all depends on her biology to get that group to grow. And then after about 2 weeks, we extract those eggs through a very, very minor surgery. It's like with just a needle. And now we have the eggs outside the body, and then we fertilize them. Put them in an incubator, and then allow those fertilized eggs to grow into embryos. The first question is, why not just extract one egg at a time and see what happens? You could do that, but the problem is the process of attrition. So if you pull eggs out of an ovary, not all of them will be mature. Probably about 75% will be mature, and like it could actually fertilize. Then you put you couple the sperm and egg together. How many will actually fertilize? And we have a variety of technologies to help overcome certain issues. Well, with all things optimal, about 75%, 80% will fertilize.
Okay, so you go 70% and then 80% of the 70%. So now you're down to roughly like 56%.
Yeah, so let's just break it down with like 10. So you have 10 good eggs. Now we're down to 7 fertilized eggs. Then back in the incubator, they go and we allow those fertilized eggs to turn into embryos that will become that can implant. About 50% will do that. So now we're going from 7 to 3. So then now we have 3 embryos. Now at this point, you brought up things, we should just put them back and hope they stick, hope one sticks. What we do now is we actually can test them. So that we can do genetic testing on these embryos and we can tell which embryos will implant and which ones won't. It's not exact, but we can definitely tell which ones won't implant. So with those, now you're down to 3 embryos, right? And we test them. We actually freeze them because it's a process that takes time. You get a little report with each one of these embryos and you can say, this embryo will implant, this one won't. This embryo could implant, but if it does, it would be a first trimester loss. It could be a second trimester loss. And this is it's really scary. It's like, oh, this embryo would be a third trimester loss with like profound birth defects, not compatible with life. So you can see all that.
You can see that
before you put it back. Now
cow.
But the main tool is you can know this is the group that could be a viable baby, could be, and these ones will never be. Even though they're live embryos, they will never be a baby. You can say that with a surety. And so now, but now that's where maternal age, you brought up the geriatric pregnancy. This is where age comes in. With someone who's say 25, you have 3 embryos. 25, 1/3 of those embryos are going to be abnormal, would never implant.
Okay, so you're down from 10, you're down to 2. That could make a viable, healthy baby. Could make it.
Could make it. And now, but let's do. Most patients aren't 25. Let's say she's 35. About 50%, 50 to 60% are going to be abnormal. So now you're down to hopefully now you're flipping a coin. Get a quarter out 3 times and flip it. You'll probably get 1 normal.
Okay, and that's before you even put it back into the oven.
Exactly. So this answers the question, why do we need so many? You get down to that point. So, but the good news, you flip that quarter, that the probabilities, right? Yes, we have a normal embryo that's healthy. Then we go to put it back. Then now the odds are really good. It ranges. Depends on the clinic, the embryo, the uterus. There's a lot of factors.
Sure.
Most patients, it's about 50 to 75% success. So it's there. But if you only have 1, on our best day, you still have 25% walk away with nothing. That's starting with 10 eggs.
Golly.
So that's why we want to fertilize so many, because in the end, you're probably only get that 1 baby.
And that's, so again, when you're saying you go from the 10 to the 1, that you're like, viable, we're going to put this back in. You still have human variability with the whole pregnancy, and can the mother actually, like, is the nutrition correct? Does the body take it correctly? Your attrition from 10 to 1 is really just, hey, does this one even have a shot? And then we put it back in and we're like, please God, let it have a shot. Right?
Fingers crossed. Yeah. Oh, then you brought, yes, we got it. Yeah. Literally that is going on in our clinic. Yes, we got it.
Wow. And so if you're dealing with a family that starts perhaps later in life that has to go through IVF, you may be going through 1 to, I don't know, let's say just a probability, 1 to 3 rounds of this entire thing to get 1 successful pregnancy out of this.
Yes.
Like
So-
if you're dealing with like, say, a 38, 39, 40-year-old.
Yeah, it just depends on the age, diagnosis, and then kind of like tailored to her is her egg reserve. Like how many eggs does she have? And then age plays back into it. So when we look at that group of embryos, so like I said, a 25-year-old, so 30% will be abnormal. A 40-year-old, 2 out of 10 will be normal. 1 out of 5 will be normal. If a 45-year-old, 1 out of 10 will be normal.
Okay, so in general,
That's not out of eggs. That's out of embryos. You still have to go through that whole process.
Right.
So you take someone who's 40 years old, how many cycles before they can go get that embryo that actually work?
gosh, man. So how many eggs do you, like, say I walk in and I'm like a reasonably healthy 40-year-old, like, and I'm a woman, which I never have been, but never will be, but I have ovaries. This person walks in and they're like, hey, how many eggs do you have to pull? You're going to say like, we're going to pull 20, or do you really try to pull 10? I mean,
well, it's now it goes back to her biology. So the way the ovary works is all the eggs a woman ever is going to have were made when she was actually an embryo herself. And then they just sit there and then they're released in these cohorts. That's all genetic pre-programming.
sure.
We can't control it. No matter, so we can take somebody and we can put them on birth control. We can put them into like medically induced menopause. Still that process of eggs in these waves are being released. And it's up to the body to recruit one or not. And then the rest just go away. So the body recruits one, maybe two, twins happen. And then the rest just go away. They dissolve. And then in our process, we take that group and we apply medicine. We kind of bypass that physiology to get that group to grow. That group is all pre-programmed. So in your average 25-year-old, you get probably 20 to 30 eggs. In a 40-year-old, 6 to 8. If that's your average.
Gosh, you're like breaking all this down. It just seems like an impossible feat just from a statistics standpoint.
Not impossible, but
like obviously not impossible, but
not easy. And it really depends. So then you tailor. So like, some 40-year-olds will have, you actually can pull more eggs, some less. So 40-year-old comes in, it's like, we're going to only get maybe 2 or 3 eggs at a time. You have a lot of people say, no, I just want to do IVF. And we'll be done.
And we'll be done.
And they're like, oh, this is, you and I, this is, and you look and it's like, okay, this is what's going on. I think we can get this, but this is going to be a process together. And this is where you rob your couple of eggs. They spent $100K on treatments because they needed so many treatments, so many cycles before they actually got it. But they can get it eventually. It's just not as straightforward as just one IVF cycle.
And correct me if I'm wrong, but we're dealing with an ever increasing in age parent population, meaning like the people that the age where people on average start trying to reproduce and make families, that's getting older and older, right? Like that's not going in reverse.
Oh, correct? No. Yeah. Well, and then also, like you said, there's a bit of a misconception of what we can do. Also, People Magazine is kind of a problem where you have
People Magazine specifically.
Yeah.
Okay, right.
Where you have 50-year-old.
That's oddly specific.
50-year-old celebrities having twins.
Oh yeah.
That does not happen. They can do it, but they're not their eggs.
Oh, so they're not even getting their own genetics.
Not their genetics, but they can have a baby, or they
can carry the baby, but it's not theirs.
But that doesn't come up in the articles. Like, look at this celebrity. She's beautiful. She's so healthy, and there she is. And by the way, she's 49. So like, if she can do it, I'm perfectly healthy. I can do it too.
Yeah, I'm 5 years younger than she is. I'm 44. I can go do this.
No one puts in there that she used donor eggs.
Oh, wow.
To do this. Donor eggs are extremely successful. They work very well. But that's a different mindset for a couple who comes, we're wired to get our genes into the next generation. And to not do that takes a lot of working through.
So if People Magazine comes out with an article about how Madonna just had triplets, everybody got to calm down. First off, that's not her accent. Second, those are not actually her eggs. Mm-hmm. She got donated eggs. She got, maybe donated from where, like sperm from wherever.
There's a whole process.
There's a whole thing. And it's like, listen, maybe she carried the kids at a miracle of modern medicine, but this was not her actually producing these genetics.
So, and again, donor eggs are such a terrific thing. And it's a terrific thing that women are willing to donate their eggs to enable the creation of families where there would be none. So it's wonderful, but it's misleading when you see in the news mainly celebrities having kids that are too old to be having that. Is just not, it's not possible.
I had a family when my oldest was going to preschool. There's a family there. They were really cool people. They had a bunch of little boys too. We had little boys, and the mom was pregnant through part of the time that we knew them. And I was like, "Oh, congratulations!" They're like, "No, it's not ours." I'm like, odd question. How do you mean? Right. And it turned out that she was the surrogate mom to carry this baby for this couple, man and woman, who could not, for whatever reason, the woman in the couple could not carry the baby. So it was her egg. It was his sperm. They had fertilized it outside the body. And then she had agreed to carry and deliver this baby. And what was really interesting is after she had delivered the baby, kind of just not trying to pry. They were our friends. Like, was there a lot of emotional attachment? Like, did you? And she was like, not really. Like, yeah, I care about this kid in the abstract, but it's not really my kid. I'm like, isn't that hard to have the kid? You deliver the kid and kid comes out. She's like, no, the kid's Asian. Like, there was this Caucasian mom. She's like, no, it was really not ours. Like, this baby came out. It was beautiful. I was so happy to be part of it, but it's like, doesn't even remotely look like me. And what an incredible thing that they were able to do that. But like, wow, that you have this team in place to not only extract eggs, get the sperm, fertilize things, keep everything going, then you have to have somebody else carry it. I mean, what an adventure.
That is a good word for it. We call it a journey.
A journey. We're on a crazy journey.
So there's actually a lot of surrogacy journeys here in Idaho where people come from all over the world. And the whys, I think just things like naturally evolve that way. But people's like, oh, you're worried the woman's going to take the baby. It never happens because by law, genetically, that baby cannot be hers. So the sperm and egg have to come from somewhere else. The embryo's created, then put back in her. And although she delivers a baby, sure, there's something could happen.
Sure.
The spectrum of anything can happen is always
crazy
there.
people.
But for the most part, it's like, oh yeah, they're happy to do it, but the kid's not theirs genetically.
Right.
And so they're happy to give that kid back to the parents.
Sure.
And it's actually a pretty, it's going to, people are people, it can have its challenges, but for the most part, it's a very smooth process. It works really well. And to our legislatures here, the credit here in Idaho, before we get too hard on them, right? They pass really good laws here in Idaho that make it a really good process, a very safe process here in Idaho.
Talk to me about this, because one of the things that I know has come up recently is IVF. Abortion is legal. Understand, like, no problem, at least in the state of Idaho, and with few exceptions. Okay, like, not concerned about that right now. What is interesting, though, is some of the people that I heard articulate concerns about abortion also started to focus their lens on IVF, because they're like, listen, you have a certain number of eggs that get fertilized. And even in your articulation, which is like, okay, but this kid wouldn't, like, a probability of this embryo taking to term is like 1%. They're like, but that's a 1%, which means that's a life, which means you're effectively killing this life. And there has been pushback from people that are family-loving, God-fearing individuals that are just saying, hey, we don't like this process. It's like, well, hang on a sec. Like, first off, we have miscarriages in the natural process of things with having children the natural way, right? Like, that's a thing. So you take a risk there. And if we apply these same principles, which you have over here, to this situation where you have these people that very much want children, these are very much wanted pregnancies. People are investing an incredible amount of resources and time and energy and diligently going out. This was not like a passionate thing after prom. Like, this is like, these are two 40-year-olds that want to make a family. These are different situations.
Well, absolutely. Well, I mean, I think my motto is like, the motto of our field is we create families where none would exist. That's what we're doing. We're building families, creating them. And so to understand the mindset, people they don't like the process. They don't like the technology. They just don't like it. You're playing God. That's a frequent, I don't like that. That's told to me. The issue is kind of like, why do you think that? You got to understand that. It's interesting because most of the time they don't understand the process. They don't understand why it's done, who it's really done for, and kind of like what the ultimate outcome is. But they've been told by an overarching authority that this is bad. And then it's like, that's bad. And that it's likened to abortion because they're throwing life away.
Where do you think the commentary that it's bad comes from? Do you think that's
religious leaders? No, absolutely.
Why do you think they're doing that? And I can't ask you to comment.
Well,
on a lot
I
of
mean,
things.
yeah, I don't want to. I won't mention specific religions.
No,
but
let's not,
but at the same. So
I'll
so
mention my wife's family's Catholic, and I do know that my in-laws get like a Catholic quarterly magazine or newspaper or something, and I have had conversations with members of that family about IVF, and there was commentary in those conversations from the other side saying like, well, if God wanted people to have kids, they would be having kids. And if he doesn't, like, again, your comment. So just looking at the Catholic religion, I do know from personal experience, not calling anybody out, but it's like that at least some people have been, have been presented with the idea that it is inappropriate.
Yeah, the idea of even creating a baby with a non-coital act, that's kind of how they term it. It's like
Coital. There's like two people natural.
it's not a word we use anywhere, but in religious speak, that coitus must occur for this baby to have like a holy union. And then that's the only way this should ever occur, period. And so that's kind of like, okay, that's kind of like that's your base kind of dogma, kind of that thought process. And then that's delivered to people. Now, the issue is it's not like, well, but when someone wants a family and they realize they can't, then they want a family,
like,
and so
listen, I like what you're doing over here. I'm with you 9 out of 10. Just look the other way because we got to go over here to this place.
Well, it's, you're
like, I'm Catholic. I'm not a good Catholic. So like, let's be clear. I'm going to break this one rule. Yeah.
But I think that's that's where they're being told this and they think this. And then of course, abortion, under no, like, I know this is not supposed to be an abortion conversation, but abortion's not a good thing. It's unfortunate that it has to take place.
Sure.
Right? In the circumstances it does take place. It's
unfortunate that it does take place, even if some people agree if it does have to happen or does that. It's terrible. No one under any circumstance is happy about that.
That the fact that we arrived at that point that it needs to be done, you could argue
however
about,
you want to define it.
But it's like this there's a loss of a life, right? So as I described, so when you put egg and sperm together, there's this other kind of dogma. It's like, okay, where does life start? Now you can argue about it, but no one really knows, right? Putting at the point of fertilization. Now, there was just recently a bill proposed this session. It was like, we want law to state that life occurs when sperm and egg come together. There's no science principle that says that's life. We don't even know what life is, right? Like the soul and all of that. So we can tell you when the DNA activates in an embryo. So this is interesting to even think about. So you put a sperm and egg together, right? So the sperm has DNA, half your DNA. The egg has half the DNA. You put them together. The egg allows the sperm to enter. It delivers its DNA, and then it's done. Okay, where do you think is like, what's going on with these embryos? So the sperm inserts the DNA, and it's done.
Sure.
It doesn't contribute to anything else. Now the egg gets the DNA, and it has to organize it, replicate it, right? That process is all managed by the egg. Okay, the organelles in that egg, the egg is a single cell, were all made whenever that woman was created. So they just kind of sit there, and then it starts organizing, and then it starts splitting. But it's still just an egg that has the sperm's DNA in it, right? It's going from 1 to 2, 2 to 4, 4 to 8, 8 to 16, and so on. That occurs over about 4 days. At what's called the morula stage. It's about 200 cells. Then the DNA activates, and the cells start to differentiate. If you're gonna say, okay, if you want to talk about science, like when does it like a fertilized egg become an individual? It'd be like, well, the DNA activates at the morula stage 4 days later. And then it starts differentiating. Now you got 2 cell types, an inner cell mass and a trophectoderm. It's not a heartbeat. Some would argue the heartbeat, that's just like a pump. Activated DNA, now that's an embryo that can implant and it's differentiating its own cell. So you take that cell from that embryo at that stage, now it has a unique DNA fingerprint, right? DNA fingerprint apart from any other individual in the world.
Wow, man.
So this
is a lot.
Yeah. So it's kind of like, I think, we talk about the heart and the emotion of it, and it's like wrapped up in like Valentine's Day. But it's also like pulled into like the ethics of when can you do an abortion? Well, what the heart has, the heart is pumping blood, and it's a symbol of how far along an individual is developed. But it's like, well, we should talk science if we're going to actually talk about this. But again, anyway, so that's just an interesting aspect. So now an embryo that can implant is its own individual. That's when we do the genetic testing. is at that stage because that little fingerprint, that embryo is unique.
Do you guys literally yank out one tiny cell from this embryo and test it?
About 5. This is another modern miracle. Okay.
Like, how are you getting like?
I have at Idaho Center for Reproductive Medicine. I have 5 scientists at a PhD level. Okay, these people are very educated, very unique individuals. They can take an embryo, which is microscopic, and we have these little robotic arms they use, and they can open it up a little bit, and they can remove 5 cells from an embryo that has about 250 cells. They can remove 5. From those 5 cells, then we actually send those off to a specialized lab. There's only a handful in the country that can do this. This is another modern miracle. They can amplify the DNA out from 5 cells to then analyze. If I do a DNA test on you, I have 100 million, like a swab or blood, 100 million cells. You lyse open those cells, you have lots of DNA to work with.
Sure.
The fact that we can take 5 cells, amplicate it accurately enough to then analyze it, it's another miracle.
God, man, you guys are doing crazy things to make families. God bless it.
Yeah. So then that's the data that we have. Now we can't predict eye color, hair color. The other important thing, we can't change the embryos.
I was going to say
we're not redesigning embryos, and we're not manipulating.
Well, maybe not
them.
you.
Yeah.
Somebody might be.
Yeah, I mean, right now in a basic science lab, CRISPR is now in the media. The CRISPR gene splicing and all that. It's just another kind of miracle. Could you apply CRISPR to an embryo? Or I guess you could, but the ethics of it would not be,
not good.
Not good.
Yeah, that's not legal in the United States.
No, I mean that's definitely not. And it just depends on the goals of it too. I mean, there is discussion whether certain diseases, then you could do gene editing. So they're doing gene editing on individuals, right? Where you can modify a disease process to make somebody not have the disease anymore. Could you do that to an embryo? You can. You could, but you cannot. It's not being done.
Dr. Tobler, listen to me. We obviously need to schedule 2 hours.
Sure. Yeah, we do.
I want, we haven't even got to legislation. We haven't got to, President Trump talking about IVF for everyone who wants it. I have so many more questions just about the mechanics of all this. Please come back. Can we please schedule another time?
Absolutely.
Because
I like to talk.
This is great. And I'm tracking 100% of what you're saying. I did not anticipate that it was going to be like this. And again, so let's come back. Let's keep the conversation going. Let's talk about the legislation, because you're saying Idaho does a good job protecting this, and that's wonderful. What were you going to say? You were going to say something.
Yes, I know. Because right now there's this. I mean, I think part of the reason we're talking about this is because there's kind of this looming threat right now in the legislature. There's discussion. I don't think it has a lot of support, but there is a threat there that they, just like abortion, they would like to shut it down and find that mechanism for it. So that's where we're having the conversation is, and we definitely need to kind of further up. And they should not do that, and they should not interfere. Guys, to end this, I guess my thought would be, it's the reason we do what we do is for efficacy, to get the baby, not to waste life, not to create surplus embryos, it's to do it in a way that actually a family can go through it, and they're going to spend their resources, and the emotional toil of putting an embryo back in somebody and having it not take is huge. But anyway, so they go through that whole process with the goal of a baby. If you muddle that up, they could go through the process. No one wants to just do an IVF cycle. They want to get a baby. So that is the only reason we do it. It's evidence-driven techniques that get that to happen. And if it gets framed in a certain way where it turns into a life discussion, and then it won't work for people.
Let's have that conversation. Okay. I'm so happy you came today. I can't wait to hear more about this. I want to hear about what people are talking about, because again, I think you are right that there's this conversation on the side that is largely driven. People should be driven by principles, and there are principles in play that kind of when applied to this process, you get an outcome. It's like, well, maybe we shouldn't be doing that. But again, I want to talk through this with you. God bless it. Okay. Thank you for coming, sir. I really appreciate it. Let's get lined up before you leave. All right. Thank you.